Good afternoon to everyone, and welcome to this online panel discussion hosted by the Human Rights Program of Roosevelt Public Policy Institute at Hunter College, together with the Sisterhood Global Institute. As this coronavirus crisis grows exponentially, around the world, the medical advice and increasingly the legal mandate is to shelter at home to prevent the spread of the virus. Sheltering at home clearly saves lives from a medical perspective, but for many women, sheltering at home can be life-threatening. In the context of domestic violence, home can be the most dangerous place for women. Women leave home to find shelter and safety, or they wait until their abusers leave home to call for help. Here in the United States, millions of women face domestic violence every year, and thousands lose their lives as a result. Today, we're going to get an update from women's rights advocates in Afghanistan, Palestine, Peru, and the United States. Many are facing the same problems, and hopefully we can share some creative ideas that can help save lives and get women the protection they need in this new world of COVID-19. I want to thank our amazing panelists, whom it is now my pleasure to introduce to you. Carmen Espinoza, Executive Director of Manuela Ramos in Peru. Shafiqa Noori, the Executive Director of Humanitarian Assistance for the Women and Children of Afghanistan, also known as HACA. Randa, Siniora, Executive Director of Women's Center for Legal Aid and Counseling, or WCLAC, in Palestine. And Diane Rosenfeld, Director of the Gender Violence Program at Harvard Law School here in the US.
Always when it comes to such difficult, catastrophic situations, they ask us as women to relegate our own needs and violence, which is pandemic as well, to relegate it to after the emergency situation. In my opinion, the challenge to us as women activists is really to persist that it goes hand in hand with our fight and combating of the COVID-19. We cannot wait until the situation ends. We reach out the women, we address their needs immediately. We can't say, wait until the situation ends. She might pay her life. We expect an increase in violence against women. Home is not the most safe place for women. The latest survey conducted by the Palestinian Central Bureau of Statistics showed that 29% of Palestinian women were subjected to violence. We have opened the free lines for consultation, psychosocial and other kind of consultations. We are getting calls and we are responding to them and trying to maintain the confidentiality of the women. But we expect that girls and women will approach us much more as the situation continues. But definitely the internal responsibilities within the household, women as being the main housewives and taking care of the elderly, disabled, and the children, the more responsibilities are increasing on them, the more pressure that is occurring now.
Women, as many people talked about, are caretakers, and that we are the ones who are tasked with caring for others. And this is a time where the pressures on women's caretaking are enormous. At the U.S. Supreme Court, at the highest level of our law, women have no rights to challenge domestic or sexual violence. And that's really significant because not only in the White House, but our law, our legal system does not put women in any position where they can challenge patriarchal sexual domination. Right now, women are really isolated, and isolation is always the key tactic of abusive partners. And we have to focus on fighting that isolation with whatever means we have, whatever ways we can intervene in somebody's home by calling and checking in and emailing and offering spaces and looking for signs, creating code words so that we know when we need to really jump in and help.
We have heard there are more than 5,000 phone calls to the emergency line to prevent violence against women. 9 days of the lockdown, we have had 43 rape cases, 27 of them children, and we have had 25 cases of women going to shelters.
Although not much time has passed from the spread of coronavirus in Afghanistan, we have already recorded a large number of women and girls referring to the Women Protection Center for support. On 28th of March, most of the government offices has been closed to prevent the spread of COVID-19. But we are concerned about the women victims of violence and how they could reach the authorities and take the help of the Women Protection Centers.
So violence is a huge problem for us. And the other problem is because the majority of the population, we have what we call an informal economy. 70% of the economy is informal, many women, and 30% of the household heads are women.
If the government put more pressure and stop people from going out, then it will be the hunger, then will kill more people than COVID-19. This situation has a direct negative impact on the lives of women and children, since in Afghanistan, one of the most important elements that increases violence against women and children abuse is poverty. If the financial status of the people gets worse, then the violence will definitely increase. Not so long ago, we have already witnessed how the families had to sell their children, and especially daughters, to feed the remaining children. Poor economy always been one of the key factors for children marriage in Afghanistan.
We are working together with the Ministry of Women, and we are going to provide volunteers for them to answer the special line to prevent violence, and also we are going to distribute their materials.
Currently, more than 50 women and their children are protected in Hakka Women Protection Center, and we have already taken protective measures to save them from getting infected with coronavirus. We have minimized the visit to the shelter. We also have bought antiseptic and food so that we do not have shortage of these materials if the situation gets worse. There are many widows who have lost their male members of the family in war and suicide attacks, and who has no choice but to go out and earn money to feed their families. These widows have been provided with the basic support by Hakka, but required additional support. If they do not get support, and if the quarantine continues in the city, they will definitely die of hunger. Before the situation gets worse and a total lockdown takes place, we are asking the help of our donors and supporters to help us save these families.
CLAC is cooperating with the official institutions. We want to make sure that with the Ministry of Social Development and with other shelters, and with the official family units in the police. We also asked that we wanted to see more women in the emergency committees and at the local authorities in order to be engaged in the voluntary work and the emergency situation under which we currently live.
Our governors and mayors are really important action people right now, and we need to create a united front and ask for and demand resources, especially for women.
Nobody is thinking about the priority needs of women who are, in maternity or in special needs. So now some of the organizations are thinking of the dignity kits.
Well, I think that if women were in charge equally in the running of the world, we would be much better situated to deal with it. And one reason is because women actually do care about other women as human beings. And this is reflected in our much, much less common use of violence and use of violence as a language or as a political tool or weapon. So let's try to keep optimistic in this moment and find hope within each other.
We have to look at this within this unfair economic system under which worldwide we're living, where there is disparity, there is poverty, there is distribution of property in the wrong way. We have to overcome that with solidarity.
I think we should take this pandemic as an opportunity, but not to create business, not for corporations, but for us to reassure how strong we are, how positive we are, how we can run the world. Yeah, we can, but the enormous work we can accomplish when we are together.
This is a moment for solidarity, and I really feel that today, and it's really important to keep the hope, as Diane said. So I want to thank all of you, and I want to thank everyone who joined us